Alright, so for the next aspect of orthopedics, which we'll be looking at, is the approach to what? Bony lumps. Approach to bony lumps. So for this approach, okay, so we'll look at what bony lumps is. Basically, you're having a lump, all right, bony knob, and all of that. So look at benign tumor, benign bone tumors. We look at bony knobs. We look at bone spurs. We look at osteophytes. Okay. So what we have here is bony spurs, which is the first one. Bony spurs are also known as osteophytes. Okay. So they are bony growths that appear on the outside of the bones, often around joints or in the spine. So they can be caused by what? Arthritis. Maybe somebody's aging up. Maybe there's injuries. All right. Maybe poor posture or hereditary. So bone spurs are usually not painful, but they can cause problems if they irritate nerves. All right. Also, if they interfere with the joint movement, or like they now end up putting unnecessary pressure on the nearby structures, right? So sometimes it can put a lot of pressure on the nerves, right? So for bony lumps, there's different ways in which you can actually approach it when you're trying to clerk it, right? So let me say for a bony lump now, you might want to actually access it by trying to estimate the size. So a large lump attached to the bone, or a lump that is getting bigger, is likely to be a tumor. So from properly assessing it, you can basically try to access the degree of the problem site, right? So you're trying to look at where the tumor is actually located. Margin. You are trying to see if the margin of the tumor is well defined or, all right, is ill defined. Consistency. So a benign tumor feels bony hard. Malignant tumors often give the impression that they can be indented. Tenderness. So lumps, tenderness is due to what? There is an active inflammation still ongoing, right? So you feel it and the patient actually screams a lot. Tell you that there's an active inflammation going on. So multiplicity. So you are seeing plenty lumps, right? So you show you that there's things like what? Hereditary multiple exostosis or the Olier's disease. Alright, so bony lump that we've been talking about.